Hi, I'm Dr. Alex Wilshire, District Behaviorist at Old Bridge Public Schools, here to talk to you about COVID-19, the basics. What is COVID-19? COVID-19 stands for Coronavirus Disease 2019. It is a respiratory illness, meaning that it will affect your breathing. Currently, COVID-19 is a pandemic, meaning that there is an outbreak of the disease that's spreading worldwide. Now, the reason why it's a pandemic is because it's a new disease, meaning that the human race has no immunity against it. There are currently no vaccines and no antiviral treatments for this disease. Symptoms range from mild to severe complications. Mild symptoms include fever, cough, and shortness of breath. Severe complications could include pneumonia in both lungs, multi-organ failure, and even death. How does COVID-19 spread? It spreads mostly from person to person, meaning mostly through respiratory droplets from the infected person to those who are within 6 feet. The infected person sneezes, coughs, or talks and will put respiratory droplets out into the air. And if you're within 6 feet of that infected person, you may inhale or ingest those droplets and become infected. Another less common way of COVID-19 spreading is through touching surfaces that have these respiratory droplets. For that reason, it's important to wash your hands often and to avoid touching your mouth, your nose, and your eyes. Here's a graph of how to flatten the curve. So flattening the curve means that we want to make sure that we slow the spread of the disease. The red curve shows what it would look like if we did not take any protective measures. You'll see the dotted line is the healthcare system capacity. That means the ability for doctors, hospitals, and healthcare workers to service sick people. If we do not take protective measures such as social distancing to flatten the curve, those that are above in that red curve, those above that dotted line, will not receive health care. If we work together and practice those protective measures such as social distancing, we will together flatten the curve and be that blue curve where healthcare professionals will be able to service those that are sick and not be overwhelmed. Social distancing. That means stay home as much as possible. Schools have closed and moved to remote distance learning. Parents and adults have been working from home. Unless you're an essential worker, then you should stay home as much as possible. If you need to leave the house to get essentials such as medicine or food, then please keep social distancing. Keep social distancing in mind, meaning keep 6 feet apart from others who are not in your home. Wear a cloth face covering to prevent the spread of your germs to others. Avoid public transportation and ride sharing. And again, make sure that you stay home when you do not need to leave the house. If you want to go out to get some fresh air and to go take a walk or bike, please maintain that social distance of 6 feet to keep yourself and others safe. Finally, to limit the exposure, practice good hygiene. Wash your hands often for 20 seconds. Sing the ABCs. That's about 20 seconds. Wash with soap and water. If water and soap are not available, use hand sanitizer. Make sure there's at least 60% alcohol. Avoid touching your face. Again, your eyes, your nose, and your mouth. Disinfect high traffic areas, such as doorknobs, light switches, and handles. And I just want to take a moment to thank our healthcare workers for being out and taking care of our sick. Thank you.